Thank you, everyone. Thank you, everyone, for joining us today for our panel, Expanding the Legacy of Latina Leaders in Behavioral Health in the Behavioral Health Field, Insights and Recommendations. Today, we're honored to be accompanied by some of the members of our steering committee who are Latina leaders in the behavioral health field: Teresa Chapa, Telma Garcia, Otila Garcia, Veronica Vega, Maxine Henry, and Mila Lopez. We want to share with you that we will be having simultaneous translation to Spanish. So if you would like to use this feature, click the interpretation tab and then click Spanish. Today's event will be recorded. All participants will be muted and the cameras will be turned off. Please make sure that your speakers are turned on and up so that you can hear today's presentation. If at any point you have technical issues, please send us a message. You can use our chat box and we'll be happy to respond. Also, if you have any questions for our presenters, you can use the Q&A feature, hit send, and we will have a Q&A session at the end of the panel. We will also be sharing a copy of today's presentation via our website. It is very important that once we complete the panel, that you complete our evaluation. This is one of the requirements for us to be able to continue to offer panels, trainings, and webinars such as this. So we just ask that we will share a link via our chat box, and it takes about 2 minutes, and it will be very helpful for us to receive your feedback regarding today's presentation. So, as some of you know, the mission of our center is to advance and support the sustainability of behavioral health equity by promoting community-driven, culturally grounded, and person-centered prevention, intervention, multiple pathways of recovery, and recovery supports for diverse Hispanic and Latinx communities. I will make a comment about that now. So our center recognizes the complexities associated with gender and ethnic identification, as well as the rights of all individuals to self-identify. Our center has decided to use the term Latine with the intention of both facilitating a fluent reading and pronunciation and supporting an inclusive and respectful language. Latina is a gender-neutral term from the word Latino that uses the letter E at the end, an idea native to the Spanish language. So I will give you an overview of how we decided to share this panel with you. As you know, one of the goals of our center, of the Hispanic Latino Behavioral Health Center of Excellence, is to promote the development of the workforce and increase equity in behavioral health services for Latina populations living in the US. As you know, during the month of March, we celebrate Women's Month, Women's History Month, and specifically March 8th commemorates and recognizes women workers, their efforts and sacrifices, bridging salary gaps, among other things. We know that there are approximately 63 million Latinos in the US, and that about 30 million are Latinas. So in terms of the workforce, the numbers indicate that 12 million Latinas are part of the labor force. This is a large number. In the last 10 years, the number of Latinas who have completed a bachelor degree has doubled. So what does this mean? More Latinas will be entering the workforce. Literature and experience indicates that women face challenges related to being a woman in the workplace. What does this mean? Gender discrimination, harassment, lack of presence in leadership positions, and inequity in pay is common among women workers and even more so among Latinas. So for Latinas, sometimes the expectations and roles that traditionally have been assigned to their gender can be a challenge or a strength, depending on how you integrate this information and cultural values. Today, we will have a conversation with 6 Latinas who hold leadership positions in the behavioral health field and who will share with us part of their journeys, achievements, and challenges. We will also talk about the role that culture has played in their development as a professional in the field. They will share recommendations for other Latinas who aspire to achieve leadership positions in the field of behavioral health. So let's meet our panelists. We will thank you all for joining us. So please tell us your name, your country of origin, the work that you do, and what motivated you to do it. And we'll begin with Teresa Chapa.
Well, hello, everybody. I'm Teresa Chapa, and I identify as Mexicana, Chicana, Latina, all of them, because I feel unity with all of my comadres here and my compadres and all people across our spectrum. I grew up in LA and San Francisco, although I started my career as a nurse in mental health. I'm a clinical psychologist with postdoctoral master's degree in policy and leadership. And I've been working in the field and had leadership positions for about 35 years. I know you can't tell, but and they've been a variety of positions, including community-based, county, state, advisory committees, university, and at the federal level. For the past 5 years, I've had the honor to serve as a regional vice president for an agency here in San Diego, but we're both in Southern California as well as in Northern California and Oakland. And I lead 4 counties of services, and we're called Fred Finch Youth and Family Services. I'm located in San Diego. For those who are here, I saw a little bit of a shout out. And I know you asked like how we came to the field, and I gravitated to the field actually from high school when I was assigned to work in a special education class. My heart went out to how I saw the children being treated. Later, I was inspired doing nursing rotations in the mental health rotation, the psychiatry rotation, where I saw persons who had attempted suicide and there was very little care for them. And that really called me to service. And I followed the footsteps of many of our 4 sister Latinas that were practitioners at that time. So that's a little bit about how I came to the field. Thank you.
Thank you, Teresa. Wonderful. So Thelma, would you share with us your name, your country of origin, the work that you do, and what motivated you to do work in this field?
Can you hear me?
Yes.
Okay, I have to take off then. I'm sorry, I apologize for that. My name is Thelma Garcia. I work for the East Los Angeles Women's Center. I've been here for over 27 years. I was born in Guatemala. I'm Maya Quiche, 100%, proud of my culture. And also here, they live in the United States, Latina, working for women survivors of domestic violence, sexual assault, and the risk for HIV. I've been doing this work because it's a passion that came from my mother, who was the pioneer coming to the United States with no support and wanted to give us a better life. And she accomplished that as I been working here for so long, being the director of HIV prevention services, providing services for the indigenous and immigrant populations. And I've been part of a lot of panels, steering committees, advisory boards, nationally and local. And this is what I do, and my passion is to prevent and being disease, mental health, and just supporting our women.
Thank you, Thelma. I love the element of the modeling from your mom and how that motivated you. Thank you for sharing that. Otila, will you introduce yourself and let us know a little bit about the work that you do?
Claro que sí. Buenos días a todos. Mi nombre es Otila García, trabajo para Gateway Community Health Center. Es un centro de salud comunitario ubicado en la frontera, en Laredo, Texas. Servimos 3 condados. Soy de México y vine aquí hace 30 años. ¿Por qué me emocionó este trabajo? ¿Por qué me empecé a envolver en este tipo de trabajo? Pues porque anteriormente yo era maestra en México y yo veía las necesidades de mis alumnos y me di cuenta que me encantaba ayudarlos, que para mí era un gozo, era un regalo que ellos me daban al darme la oportunidad de poder estar presentes en su vida. Entonces, cuando yo encontré esta oportunidad en este país de poder también seguir ayudando a la comunidad y a las personas que necesitaban de mi apoyo, decidí definitivamente empezar como una promotora de salud, porque de esa manera yo podía estar con las personas que más necesitaban de mi ayuda en la comunidad. A partir de ahí, siento que esa pasión ha ido aumentando y es un privilegio el que ellos me den la oportunidad de dirigirlos un poco en el control y prevención de enfermedades crónicas, en ayudarlos a navegar el sistema de salud aquí en Estados Unidos, en ocasiones hasta en la traducción de documentos, en cualquier nivel, en cualquier forma, el ayudarlos de verdad que es enriquecernos a nosotros mismos y tener una misión en la vida. Actualmente yo soy la directora del Departamento de Educación y Entrenamiento aquí en Gateway Community Health Center. Mi rol como directora y como líder del departamento es entrenar a los no solamente a los empleados que trabajan para Gateway, en poder ofrecer un servicio de excelencia a nuestros pacientes, pero también entrenar a otros compañeros promotores de salud y ayudarlos a que sigan creciendo y puedan obtener ellos más recursos, más conocimientos y que estos recursos y conocimientos lleguen a nuestra comunidad. Eso ha sido mi motivación. Tengo 28 años trabajando aquí en Gateway Community Health Center con la comunidad y anteriormente trabajé 16 años de maestra. Entonces, ustedes pueden ver mi vida, mi misión en la vida ha sido esa, servir a la comunidad. Gracias.
Thank you, Otila. Already some things coming up, including family, role models, community. So these are some of the things that we'll be touching upon later on. So thank you. And Veronica, would you like to introduce yourself and share some of your story?
Yes, thank you. Veronica Vega, Community Support Specialist at the Bridge Lake Point Neighborhood Center in Madison, Wisconsin. I am original from Ecuador. I am born and raised in Ecuador. I did move from Ecuador since 97 to an island called Bermuda, part of England. And after 3 years living in there, my husband decided to move to Wisconsin to a cold weather. So it was a huge transition from being in a hot weather to a cold weather. So I find then that we are very resilient and we can do a lot of great things. I am a member of the Latino Children's and Family Council, Formando Lazos Familiares, that we do awareness of services promoting community and engagement. I am a member of the Latino Mental Health Coalition, improving mental health and well-being on Latino-based and cultural and linguistic appropriate, Vice President and Secretary of the Ecuadorian Community in Wisconsin. I was a member of the task force for the municipal parks, Gear Up, Wisconsin Parent Advisory for Low-Income third generation and underrepresented students. I've been a volunteer of a Second Harvest food bank, sports events, Rainbow Project, Day of the Children's, among others. I have taken several classes to do my job right. And also I have a few awards. One of them is from the Pro Bono Award from the Dane County Bar Association and for special services to the community. And not too long ago, I got an award from the Rainbow Project that provides mental health to children. So I'm very, what it brings me to do my job, it is exactly that, the community that is in need, that doesn't have representation. And when I saw the need and so many great leaders in this area, so that told me that I could do this job and I can help others. Thank you.
Thank you so much, Veronica. Again, we see how the value of community is embedded in some of us. So I'm happy to hear that. You spoke about transitions, and that includes acculturation. So I think that also is part of our experience. So very happy to hear that, and we'll speak more about that. So Maxine, would you like to introduce yourself?
Sure, thank you. First of all, really honored to be here among all of these very powerful women who are doing this incredible work. Maxine Henry, I'm originally from New Mexico and have lived in the Denver metro area here in Colorado for almost the last 8 years. I identify as Chicana Latina, as just like my colleague Teresa. Right now, I am working with the University of Missouri, Kansas City, of course, remotely from Denver, which maybe I wish I was in Kansas City today because it's snowing quite a bit here. So I totally agree with you, Veronica, with the very cold weather. We are a resilient people. Anyhow, at the University of Missouri, Kansas City, we are the Collaborative Center to Advance Health Services, and we have a portfolio of about 28 federally and locally funded projects, and we work along the spectrum of public health services. One of my main roles at the university is the co-director of the Addiction Technology Transfer Center Network Coordinating Office, where we provide training and technical assistance to providers and communities who are providing services on the treatment and recovery side of services. I'm also the site PI of several other grants, and very proudly can say that one of those is in our relationship with the Hispanic Latino Behavioral Health Center of Excellence, and proud to be a steering committee member. What got me into this work? Well, honestly, it's family experience. It's watching my mom, struggle through and luckily survive a substance use disorder, spending pretty much 5th grade through 10th grade visiting my tia in prison due to, situations that she got into in order to support an addiction to heroin, losing family members to complications from substance use disorder, and really just watching our family really do their best to work through unaddressed trauma that really, brought on substance use and mental health challenges, and having my own lived experience with those things. And so my goal was just to be a part of the solution. Being raised by my maternal grandparents from the time I was 2 months old, was just reminded, you can either be part of the issue or you could be part of the solution. So that's why I'm honored to be able to do this work. Trained as a social worker, and really have expertise on the macro side of things, and then use my MBA to really support psychological safety and organizational wellness for communities across the US. Thanks for having me.
Thank you, Maxine. I appreciate it. And again, we see how values that are important to our communities come out in these conversations. The value of family, how you have been able to transform some of the experiences of possible intergenerational trauma and share your experience and help others, which is also the community and productive aspect that we have been mentioning in our introduction. So thank you. Now, Mirla, would you please introduce yourself and tell us a bit about the work that you do? So, as you know, today we're speaking about Latina leaders. And our first question to a few of our panelists is how can you, and some of you already mentioned social justice. Oh, there we go.
I had to switch to my phone while I restart my computer.
Okay.
So it's just going to be in my voice for a second. I'm sorry for all this technical difficulties.
Okay.
Like I said, my name's Mirla Lopez. I'm actually originally from Tampico, Tamaulipas, Mexico. I've been in the United States for 32 years now. I came into the United States with my mom and my brother. And I think that our whole like migration journey, being an immigrant in the United States for so long, is what really got me into the work that I do. Currently, I am the program director for the College of Medicine for the Household Centered Care Program here at the University of Houston. And my primary work is to teach future health professionals the importance of looking at patients as a person instead of just a patient walking into your clinic. And so what we do in-person home visits with nursing, medical, and social work students to address social determinants of health. And so we have, truthfully, most of our visits are social visits because we do work primarily with Latino and Black communities. And most of our conversations are about how they feel about health and challenges that they're facing. In the work that we've been doing recently, a big thing that we've noticed is that contrary to, I guess, most ideas, most participants in our program have health insurance and a primary care home, but they're not utilizing the services as much as we hope they are. And that goes back to, I'm in this work because being an undocumented immigrant myself, sometimes it's really hard to reach out. And so being a Latina, understanding where all those challenges come from really helps me to ensure that our program is very centered in the person that we're treating, the students that we are educating, and the faculty that's learning with us. So yes, I'm really, really excited to be here. I'm so excited to hear all the steering committee members. We haven't seen each other in forever, but I didn't hear a lot about what you do, so I'm learning a lot more about everybody. So I'm excited to be here today, and I'm sorry for the technical difficulties.
No worries, it happens. Thank you, Mila. I appreciate it. I mean, the panel that we have here today, as you'll see, have experience that goes beyond, right, the behavioral health field. We're talking about personal, family, community, and addressing behavioral health from different areas as community health workers, as direct providers, as educators. So I think we'll have a very rich conversation today. So let me ask our panelists, how can increasing the number of Latina leaders address social justice and health equity? And I'll ask Teresa.
Thank you, Dadis. And once again, I just want to say how wonderful it is to be here with everybody, with my team members and the public that's joined us. I'm here today because other Latinas in leadership offered me the opportunities to learn, to practice, to grow, and to leap, to learn how to take that leap. They provided me with guidance, support, mentorship, and I believe that I've made that same commitment to do the same for others. As a Latina in leadership, I think I use my position and power to promote equity. You know, we're in this space. We got to seize it. We have to recognize our privilege, to provide access to quality care, to be a voice for the underserved, a mentor, a partner. It's my duty, I believe, to extend that helping hand and to promote our human story and to elevate others. Our leadership and presence not only brings representation, which is essential, because as you see, we don't have huge representation in this field or in any field. Well, not in any field. We're represented in a lot of fields. And voice to services and to the behavioral health field overall, but also with our lived experience as shared with our with my colleagues here, cultural humility and cultural responsiveness. When I give an example that when I was employed in federal service, I won't name the administration. At that time, I noticed that there was very little understanding or familiarity with our Latina communities, especially west of the Mississippi, to be honest. I saw firsthand what resulted when they didn't include our populations in health studies, research, service delivery, program design, and outcome measures. This exclusion resulted in a host of negative outcomes, like unequal access to care, increased and unanswered health disparities, rampant stigma, low behavioral health literacy, and increased Latina youth suicidality, and ultimately premature death. And so we looked at all of these things, but our being present, by having Latinos, Latinas present, we were able to forward a change in how our communities were served. In fin, Latina behavioral health leaders in Affinity increase awareness about who we are as people, our needs, our issues, our conditions, our preferences, our languages, while also promoting opportunities, jobs, mentorship, culturally competent programs, and funding for our people and communities across the country. Without our presence, there is no social justice, there is no presence, there is no health equity. Thank you.
Thank you, Teresa. Amazing. And how you share the importance of representation, I think is one of the things that stands out for me. One of the things, because there are others, and how not being represented definitely results in inequities in a lot of areas. So I appreciate it. And now, Maxine, will you address the same question, please?
Yeah, absolutely. Hard act to follow with my comadre Teresa here, but that was beautifully said. You know, the reality is that there's power in numbers. When you're growing up in a situation where you don't see a lot of faces that look like yours, or voices that sound like yours, or experiences that mirror your experiences, it can feel very isolating, and it makes you almost wonder, am I imagining what I'm experiencing? Or, so we tend to start to gaslight ourselves into, do I deserve this equity? Do I deserve more than what has been given to me? And when we have more Latina leaders in this space, it provides an opportunity for this radical allyship, right? We are moving closer and closer to some equitable representation, but ideally we'll move past that and through that to be able to be those folks that, pull in the next person, that help lift up that next leader. Growing up in New Mexico, you would have thought I saw a lot more leaders who did look like me and came from the same, neighborhoods that I came from, and I didn't get to see a lot of that. And so that also goes with saying that I stand on the backs of a lot of giants. So it might not have been in my own personal experience in the specific system that I grew up in, but I did hear these beautiful stories of resilient folks, so every time I'm in a space where I see a Latina leader, my immediate reaction is to gravitate toward them and to ask them, about their experience and to find out how they got to the place that they were. And as Teresa said, that is our duty to do that for the next folks that, are coming into the field. We know that before the pandemic, we had probably a forecasted 30% shortage in workforce in behavioral health. And we know that that has definitely increased, and that chasm is going to be harder and harder to close, the more that communities continue to struggle. And so I think that we do everything that we do very well. And behavioral health leadership is something that we do very well. So we need to see more of us here. That's really the only way to gain equity.
Thank you, Maxine. And by gaining equity, we would be addressing social justice as well. So yes, appreciate it. I also want to mention that you already some recommendations are coming out from our panel. So one of the things that you just mentioned is if you see a Latina leader in your path, reach out, find out how they were able to reach these leadership positions and establish relationships. As we know, our communities are strongly based on relationships, and that will definitely be a starting point to achieving other goals. So thank you so much. I want to mention that if any other of the panelists want to add something else, feel free to raise your hand or mute yourself, and we'll be happy to hear you as well. So let's go to our next question. Was there, okay. Research literature indicates that for Latinas in leadership position, an important value, and we've already touched on this, an important value is meaning and commitment to the community. What are your thoughts on this? And we'll start with Thelma.
I was gonna do a little follow-up with the prior question, but I think I also support everything that Teresa said. I think that being there, supporting each other, having more Latina representation across the board is what is going to make the change, and supporting each other and not working silos. That's the main thing to be able to address a lot of issues, because our clients and participants don't come only with one issue. So I think that all of that has to be together. The question, the commitment to the community comes first from your commitment to stand, to teach, to support. Commitment is not just you trying to get a job and pay your bills. I think it is more of the whole community, and the commitment to you, for you to better yourself. That's where it starts. Because if you know how to service the community, then everything will fall in place. The commitment to not just give a number, but be there with the person through the whole process. So Latinas in the literature, I think we're underrepresented as well. So it's really not going to tell us everything we need to know about Latinas. Starting with just defining Latinas, you know, women come from different parts, and we're all not Latina. So that's my feedback.
Thank you, Thelma. Totally agree. We're speaking about Latinas today, and what does that even mean, right? So we mentioned earlier that we recognize everyone's right to self-identify. So I would say in terms of the behavioral health field, so if you're working with someone, ask how they self-identify and go from there, which is part of what you're saying. You meet the person where they're at, you work at every level, and that is part of the commitment, right? Being empathic and being sensitive and addressing other issues. I see Veronica has her hand up, so we will hear her also. Thank you, Thelma.
Thelma, I thank you so much for everything what you say. I want to validate absolutely everything what you say. It is very important that people actually engage in the community, not only find jobs and things like that, or looking for help, but also looking for ways to volunteer to help others, even though if you don't work in an organization that is helping somebody, you can always do on your own. So I really like everything what you said, Thelma. I agree with that. Thank you.
Thank you, Veronica. Let's go to Otila.
Sí, definitivamente estoy de acuerdo en que se tiene que tener un compromiso con que es un componente importante para poder llegar a una posición de liderazgo. Ahora, quiero aclarar, un compromiso no por obligación, ¿sí? Un compromiso porque te nace, porque quieres ayudar, porque estás entregada a tu trabajo. lo que uno siente lo va a reflejar. Entonces no es voy a comprometerme para yo poder llegar a una posición de liderazgo, no, eso te nace. ¿Sí? Y eso va a determinar que puedas llegar, tal vez, si tú lo deseas, a una posición de liderazgo, porque se convierte en un estilo de vida para ti. ¿Sí? No es algo que voy a aprender, es porque lo siento. Entonces, al momento que se convierte un estilo de vida para mí, como decía Verónica y Telma, no porque me están pagando de tal hora a tal hora voy a estar desempeñando y haciendo ciertas labores de mi trabajo, lo hago 24 horas al día. Y 24 horas al día no quiero decir que estoy en una llamada constante con la comunidad, pero lo hacemos con la misma familia. Desde ahí vas empezando a desarrollar esas habilidades y esa entrega que tienes hacia el servicio de los demás. Así es que comenzamos con sentirlo, con tener esa pasión, esa dedicación, esa entrega que nos lleva a un compromiso voluntario, no determinado en un salario. Entonces, es ahí donde vamos creciendo y donde vamos a ir a una posición de liderazgo que va unido al otro. Gracias.
Thank you, Otila. I agree. I think you're speaking about how this value of commitment to our communities is embedded in us, and it's a lot more than a job, right? It's a way of living. If you are committed to your community, you live to serve others. And that doesn't mean that you're gonna burn out or anything like that. You take care of yourself, but that is part of who you are. And when I think of commitment to community, I'm gonna go a little off. I think of Afrocentric values, which are a bit similar to us, and they speak about, I don't know if you've heard this, Ubuntu, the value, it means I am because we are. And in that sense, as we help others, we help ourselves. So if one member of our community is doing well, then we're all doing well. And the same goes the other way. If someone is not doing well, then we all need to chip in and contribute to the community. And that's part of our commitment. And I see Mila has her hand up, so go ahead, Mila.
I'm still on my phone, so I'm hoping it's working. Can y'all hear me? Yay. Okay. I just want to say when I was looking at some of the questions and just hearing everybody, I've been having a slight conflict with some of the ways that we're seen as just committed to the community as Latina women, because yes, it's a culture thing, but for me, I think we can talk about really giving credit to the work that Latina women do in the community. And that goes beyond like this equity thing. Like most of the women in these fields get paid okay, is what we could say. But truthfully, like what kind of support do the Latina women get in these fields? Because we are shouldering a lot. Yes, it's if not all of us are well, then we're going to step in and try to assist and do more. And that commitment comes from within. But I think we really need to talk about how does a structure help this Latina that's doing this specific work. Because I've had conflicts with myself about like, I can do more and I could do like 5 extra hours, or I can take one and, talk to one more person. And yes, we're eventually burn out. Like I'm sure like most Latinas that I know in fields like this do burn out eventually, right? Or on the verge of burnout. And so I do recognize that commitment to community is a big thing in our field, regardless of where we're talking about community work. But I think we also need to talk about how do we support that, and really recognizing that it's us that are really usually step into the fold to try to get the work done. Most of the social workers, psychiatrists that I know of that are Latina take so much, and then they end up like leaving the field because there's no support. It's not because they don't like the work, because they love it. So yes, it's embedded in us and it's super important and we give it all. But I think we also need to talk about how do we help? How do we really start talking? Because there's people that are not Latina that do probably less work than me or than us, and then they get more money. And so how do we support them? Yes, obviously you're doing a job to help yourself financially, but supporting them in the work that they're doing, but really recognizing in the effort, but also paying for the effort and recognizing that. I think I just wanted to make sure I said that.
Thank you, Mila. I agree. As I was reviewing the questions as well, I think that one of the things that maybe we won't be able to dive deep into is the structure that contributes to disparities for Latinas to hold positions of leadership. I think that's an important conversation that should be had, and we can definitely have a second, another panel to discuss that. I totally agree. That's one of the things that we will probably mention and not dive deep into, but we do need to mention it and recognize that there are structures that do not allow at times Latinas to move up to leadership positions. So I appreciate it. Thank you. Veronica, you want to say something?
I think Teresa has been waiting for a while, so I will let her go. Thank you.
I couldn't see your hand up. I'm sorry. Go ahead.
That's okay. We're probably going to say the same thing. I think everybody is right here. And it's like, how do we care for ourselves? How do we ask what we do for what we deserve? And how do we work together to achieve those mutual goals? We cannot work in silos. We cannot work alone. A lot of us have been kind of pitched to go out to a remote community or to do this or to do that. And we're lone wolves. And those lone wolves do get burned out. And it's not until recently that we really had these discussions about self-care and knowing your value. Not that we would lose our commitment, not that we don't have a commitment. We're totally committed. We totally love what we do and the people that we serve. That's why we're here. And that's why the people on the screen are not burnt out, because we know how to seek self-care. So keep that in mind, and big giant hugs to everybody. Abrazos. Take care of yourselves. Give yourself respect. Know your value. Thank you.
Thank you, Teresa. Veronica?
Yes, and that's what exactly I was going to say, Teresa. Working together with other leaders in the community. I'm so thankful to have great leaders in my community and here in Madison, that we don't walk alone. We walk together. We work together. We when we have a problem with somebody who we are not able to take care of somebody, we reach to each other. Who can help? Who can do this? Because I won't be able to do my job if I don't have somebody along with me. And I'm so proud of my community in here in Madison from these great leaderships that they have built this great community and provide a lot of services for the community. And that's what it makes us stronger. Thank you.
Thank you, Veronica. I appreciate it. And that your comment leads you to our next question. Was there a Latina mentor who played a significant role in your process? And how do you see the role of mentors for Latina professionals? And we'll start with Maxine.
This is a great question. I thought about it from the time that you all sent these over for us to think about in the last week. And I have to say, it was the woman who raised me has probably been the biggest mentor in my life. Raised me from the time I was 2 months old, when she recognized that, unfortunately, her child was not in a position to raise her grandchild. And my grandmother, my Nana, only went to the 8th grade because of family circumstances and, what she had to do in order to support herself financially. And regardless of a lack of what in the US we call formal education, she is probably one of the smartest, strongest people that I know. And she always told me, it's not about, what you don't have, it's about what you make out of what you do have. And she always just reminded me, you could do anything, whatever you put your mind to. Don't let your surrounding circumstances dictate how far you can go or how high you can reach. And so I have always had this like little nugget, this little seed of confidence in myself. And even when I do things that I'm terrified to do, that my voice is shaky, or I'm like, oh, I'm on the verge of tears, this is not going to be easy. I just always hear her voice, you know, this little poderosa, this tiny little Chicana who, you know, is like the fiercest woman that I know, that to this day, you know, I'm a very short person. She's shorter than me, and I still would not, you know, dare to challenge this powerful woman. And so what it taught me was I have the right to ask for what I need. And I don't think that the world socializes, especially Latinas, to do that. As our colleague Mirla said, right, the expectation is that we take care of everybody else because that's what our familia, that's what our comunidad has taught us to do, is that at the cost of our own health, of our own time, of our own dreams, we take care of everybody else first. And then we're blamed later for not following our dreams, for not taking care of ourselves, for getting sick. And so in all of the things that my Nana did say to me, and in all of the things that maybe she didn't know she had the right to ask for, I filled in those gaps, and I slowly learned like, oh, I'm going to ask for this. And the worst thing I could hear is no. And so my goal is always to be there for other people in the field. Of course, for anyone who is seeking allyship, but especially for Latinas. I like to move past allyship and to be other Latinas' accomplices. How do we get you what you need in order to feel safe, in order to feel fulfilled, and in order for you to recognize your own power and what you have to offer? I like to remind Latinas that you have permission to not only ask for what you need, but to say no. And no is a complete sentence. And so I need to be there for them, to be their accomplice, and to say, I know that sometimes saying no is scary, and it's okay to say it. And so for me, that is the role of a mentor for Latina professionals. Someone said earlier that the more folks that, you know, we see who look like us, it helps create less of these feelings of isolation. There have been plenty of times that I'm the only brown person in the room. There have been plenty of times that I'm the only female in the room. There have been even more times that I'm the only brown female in the room. Of course, not in this space, which I absolutely love, but that can be very, very isolating. And so just carrying that little seed from my greatest mentor has really helped me feel less alone in moments where I'm like physically alone or the only person in that room, because I remember that I'm not doing it just for me. I'm doing it for my Nana because I'm her wildest dream, but I'm also doing it for the two young men that I'm raising as my sons, right? They might not identify as females, but they will be working with females. They will be hopefully led by females in their workplace when they become professionals. And so I think that the role of mentors and mentorships, and also being a mentee, I have to tell you, I love being a mentee and I ask for mentorship everywhere I go. But again, that's part of being taught that I could ask for what I need.
Thank you, Maxine. Excellent. I love that no is a complete sentence. I will use that. Okay. So, Veronica.
Thank you. Maxine, I was wondering why we all connected so well the first time we met, and this make a lot of sense. Also, my mother lost her mom when she was 7, and didn't have she didn't have a dad, but dad wasn't very supportive, and it was very hard to manage the life with two other siblings younger than her. So at the age of 7, she raised 2 kids, one 4 and one 5, and she became the mother of these 2 kids, you know. And I raised by a strong woman, and I want to say she's my first mentor, of course. And and she always wanted better for us to become professionals, us to become stronger, us to become better persons, us to become professionals, like I said at the beginning. So I have a lot to learn from my mom, but that doesn't stop in there. When I move out of my country, I find great leaderships that have motivated me to do what I do. They through all my work experience in here in Madison, Wisconsin, I have witnessed the experience of great leaderships from people around me, people who do great job in this community. I could mention names, but I mean the list is very long. But I have a few very close that we have this little sisterhood, and that we can lay to each other, you know, and so that's why I don't feel alone. Like I said before, you know, we sometimes because people in leadership has the ability to take care of the fears, the failures, embarrassments, and the voices of people judgment. And so in staying, we learn defense mechanisms. We explore the pain in the first of this experience. And so it is very interesting and it's very inspiring for me. The leadership around me is just amazing and it's and wide. And I truly happy that I am adapting these practices in my personal life. Thank you.
Thank you, Veronica. Appreciate it. And thank you for sharing the importance of both of you of family as mentors as well, right? So appreciate it. Now, Mirla.
I just want to say Maxine and Veronica totally took like what I had thought I was going to talk about. So I'm going to try to like say something else, but I had a backup, so it's good. I thought about the question like Maxine and Veronica, and it's obviously like my mom raised us as a single parent. You know, she traveled. We literally like traveled through Mexico and desert to get here. And so obviously she's like my first mentor. But in thinking in terms of professional, because we are talking about the field, obviously that's what started me into the field and made me into the person as I am. But I've never actually had a Latino mentor, which I think is completely like absolutely crucial in the workplace here as someone that lives in the United States, because that's completely different than what my brain kind of thinks in Mexican, right? In Mexicana, like it's like the biggest thing I think from, I had a Latino supervisor that served slightly as my mentor. And I only say because he taught me that there's this word called imposter syndrome. And I lived like most of my adult life thinking about this through high school, through college, in dealing with things about like, I was the smartest person in the room in like high school and elementary, middle school, but being undocumented and living in a household with like domestic violence, it was more of like, do I deserve this? Kind of like Maxine said, like, can I voice it? Can I have those feelings? And not till I met my old supervisor did I understand that there's this called imposter syndrome, and it's completely normal because that's just the way, unfortunately, society makes you feel. Because there's a clash of cultures here, right? It's like my mom and my grandma, like they were strong women, but it was still like you don't like over talk. You don't talk about like all the awesome things that you do because you don't want to be like creída, right? You don't want to make someone feel less if you're like showing off. And so not till I started did he started telling me like, no, you're like really good at this, or this is like an awesome idea, did I start thinking that it's okay to like express and feel proud of accomplishments. And so not a Latina mentor, but a Latino, which I think is the important part of mentorship, because I don't think if I had that camaraderie where we could speak in like Spanglish, right? If I said some kind of idiom and like a Mexican one, he would understand it. but I think that was a big thing for me, like understanding there's imposter syndrome, and that's what I was suffering and keeping me back from like more accomplishments. But again, if I didn't have that sense of like, he talks like me, somewhat looks like me, he understands where I come from, was I not able? Because, you know, I don't think I was able to ever express that kind of things to my non-Latino, like coworkers or, you know, professors, like just that whole feeling of like less, like if I tell them I feel a certain way, is it going to make me even, you know, lower in that totem pole? I don't know how to say it. But I think as a professional, it's very imperative to have Latino. Like you said, being a mentee, being a mentor, maybe not a mentor, but having people around you that you can talk to and talk through these complicated feelings of, did I do okay? Of course we did okay. Like we did awesome, but it's okay to feel that way. Like you can say it, I did, you know, awesome. Like I killed that meeting or that kind of thing. I just think that, and even now, like my mom's a lot more like, open-minded. But for example, like I'll take a day off because I'm not feeling well, and she used to be like, "Te van a correr, like you're gonna get fired," like because she's used to the like grind, right? You need to go every day because you get a job. But now she's learning that I'm in a place where I can ask for things. If I need a day off because I had a really hard week and I need to take Friday off, I can ask for it. But I don't think I would be there like 5 years ago if I hadn't met some of like really strong Latino women, obviously, but that Latino supervisor that said, imposter syndrome is real. You just need to like, it's going to come, you're going to feel it every time, but you need to just like take that 2 steps and just go forward. So yes, that mentorship, obviously Latina is better because we get this whole like mothery, like kind of idea that's put onto us as Latinas. But if that's not available, finding a Latino, because we've got some slight camaraderie there that we can talk about how our culture clashes with the current society.
Thank you, Mirla. Teresa, you want to add something?
Yeah, I was going to put this on another section, but I because we're talking about mentors, I want to just say how lucky I've been, and that I've been mentored by 3 really strong Latinas. I want to give them a shout out. You know, I listened to them. They supported me. They helped me walk my path. I added my own flavor. We're not going to do exactly the same, right? We all have a different wiring in a different station. But I want to call out Dr. Carmen Carrillo, who was like the #1 Chicana Latina leader for Mission Mental Health in San Francisco back in the day. She pulled me aside and said, "You can do whatever you want." I was a nurse, I was working in mental health, but I became a psychologist because of her inspiration. There's also Yvette Flores, Dr. Yvette Flores, who was my chairperson and actually mentored me through the process of the doctoral dissertation. But more than that, gave me the assuredness that I could do it, just building on what everybody is saying about imposter syndrome and can I really do it? And do I have what it takes? And also somebody who hired me at SAMHSA a long time ago, Nelba Chavez, who I believe was the first Latina to ever run SAMHSA, and probably the last in a while, but we hope to bring more on board. But just these women were truly there for us, and they helped me believe in me, and I have so much appreciation for them.
Thank you, Teresa. Veronica, you want to add something?
Yes, I want to add something. It is very important to find a great mentor leadership in our lives. I am very lucky that I was able to find several Latino mentors that was helped me grow professional. And not only, you know, they are not only Latino, bilingual, bicultural. That what is very important, you know. I mean, it's not only you're Latino, but you also bicultural, bilingual, that are able to understand well to the community. I think that is very important. I mean, I have I want to mention 2 great leaders in here in Madison, Wisconsin, Fabiola Handam, who work for the Immigration Affairs Office, and Shiva Vidar, who is the Vice President of UW Health. So they play huge roles in this community, and without their leadership, I don't think we will have a strong community, a Latino community. Thank you.
Thank you, Veronica. And we see the importance of mentors in the development of self-assurance. It sounds like it seems to be one of the elements that stands out from our conversation. So now we're moving a bit to what we mentioned earlier in terms of structural barriers. And what we want to speak about is what are some of the things that are needed in the behavioral health field in order for Latinas to be able to be in leadership positions. We mentioned that there has been historically a lack of representation in different areas. So I included university curricula as an example, but you can address from different areas. So for this one, let's start with Teresa.
All right, thank you. I just think that with so many Latinas graduating, we need to seize this moment. We don't see them coming into our field, even though we see an increase in bachelor degrees amongst our Latinas. They actually are taking the lead, so we have a lot to be proud of. But what we really experience in our community is a level of stigma within our families, stigma around this field, stigma around, behavioral health in general. And we really need to do some work on lowering that stigma and making this type of work and career path something that's enticing, exciting, a call to action, a call to service. And that might, require a couple of things. So I just made a short list so that I could help people and not take up too much time. But like our academic centers really need to be able to not only talk to our students, but to talk to their parents, their families. And I see in some of our community colleges, this is happening and having a lot more success in lowering the stigma around behavioral health careers. Also, obviously, make academia more affordable, provide more scholarships, look for methods to help support our communities who can't really afford to take that next step because they're paying a bundle for an undergraduate degree, or even, help them take other pathways like join our community colleges, which are excellent, and then transfer. Couple the student with a Latina or Latine mentor, which I think is essential. Somebody that really cares, who will listen, like what I received when I was younger. Somebody who sat down with me and said, you can really do this. These are the steps that you're going to have to take. So know that you're going to have to, walk those miles, but you can do it. And keep in touch with them so that they can, cheer you on as you move forward. Allow for population research training and work. I mean, we really need to have a lot more focus on our communities and everything that we do, especially with services research that had kind of diminished over years. We really need to get back into that so we can learn more and have our voices into those evidence-based approaches. Also, we touched upon this a little bit, but know your value, know our values, stretch, know your limits a la vez, right? You don't throw yourself off the cliff, but at least stretch and know that you can stretch and that there are people here to help you as you try to achieve, whatever your goals are. And acknowledge the many contributions and pay tribute to those accomplishments. I mean, right here and now, we're acknowledging one another. We're paying tribute to those that were before us, but also those that are with us today. And also be with those who want to be in this place moving forward. And like the soul singer said, RESPECT, have a little respect yourself, respect others, and love your communities. Thank you.
Thank you, Teresa. Appreciate it. One of the things that stands out, you were mentioning in terms of research and reaching out, community-based research include communities as active participants in some of the studies that you were doing would be helpful. So appreciate it. Okay, so Maxine?
Yeah, all great things that Teresa listed and very imperative. I would say, it was mentioned earlier that those of us who are in leadership positions do have a level of privilege, right? We can help hold doors open, we can help open new doors. And so for me, one of the variables that's really important is to not perpetuate this practice of gatekeeping, that when I'm in a space, it's naming people's names who aren't in the room. Anytime I get an opportunity when folks are like, oh, do you know a subject matter expert on this? I'm like, oh, I know 7 people. Let me tell you their name. Let me give you their email address. But before I connect folks, I always ask, what are you going to ask for? Is this a paid opportunity? Right? Because I don't want to perpetuate this idea that, oh, if you know Latinas in the field, they're going to do it for free because they're just good at it, because this is what they do, right? I don't care if you're asking for subject matter expertise on a specific topic, or you're looking for somebody to review a translated document, or you're looking for interpretation. All of those things need to be paid for. We need to invest in our community. And as somebody who does have a level of privilege being in a leadership role, I get to be that first person to ask for that before I connect you to my colleagues. Because I don't want to give, you access to the folks that I have built relationships with who trust me, and then you're going to expect something from them for free, because that's inappropriate. And we probably wouldn't ask other experts to do things for free. I know for a fact we don't ask other experts to do things for free. So I would say definitely not participating in gatekeeping and really supporting others. I hope to live in a day where we see more Latina leadership, in this field. And until we get there, I think we also need to use our privilege when we are in these spaces to help coach the current leaders so that they really understand that they need to come from a very open mind and an open heart with these things. Of course, we know that Latina people are not a monolith. We don't all have the exact same experience. We don't all, have the same privileges, nor do we all experience the exact same disparities. And so we need to remind the institutions that we're in that we need to put relationship before task, that we need to pay people for their expertise. Even if your expertise is filling out a survey so that you can have more access to the Latina community, you need to pay me for the information that I know, right? You need to pay me to be a cultural broker. We also need to coach and remind the institutions that we work with that we need to give our communities their work back. So if you're going to ask our communities to answer surveys or to give you information about our communities, then you need to give that work back to us and tell us, what is it that you found out about our communities? What are you going to do with our communities? And how are you going to support our communities? Not continue to ask us for information and luego nothing. We hear nothing from you, right? So I think it's kind of really working on both ends of the spectrum, coaching the current leadership and holding them accountable for how they need to invest in our communities and in our future leaders, and then also holding spaces open. A lot of us do experience that imposter syndrome that Mirla was talking about. And so if I could do one thing to support one other Latina leader to not experience that even one day in her life, then I've done my job, right? And I'll continue to do that.
Thank you, Maxine. I appreciate it. Telma has her hand up, so if you want to add to that.
Yes, I want to add to that, and definitely, I know it's with the support of others who understand the work. That yes, and you mentioned universities and academia, but we cannot forget the women who is in the ground running, no matter what it is, and that is all our outreach workers, all our promotoras, all our sisters and brothers from our own families who you call out to say, come and volunteer on a Saturday morning or do a walk or do all of that. it takes all of that. And I acknowledge that, yeah, I said commitment at the very beginning, and the commitment is all this, not just working 24 hours a day. No, it's the commitment, because you can do the work in 3 hours and it's the same thing, right? But it is all those people that help us move, to help us keep strong, to help us move our agendas to better serve our communities. It's not just one person. It takes the whole community in order for us to move. But don't forget, promotoras, and I do agree with Maxine, they need to get paid, they need to be recognized, they need to be trained, because that's part of it. We ask as directors or managers or supervisors, we want to get trained, but also we need to ask that training for the people that are supporting us. So it's all together that will make us stronger.
Thank you so much, Thelma. We have a few minutes left if we want to be able to save some time for Q&A. So if it's all right with everyone, I'll move to the next question. Okay, thank you. So what challenges have you faced as a working Latina in terms of expectations? And I mean, and what role has culture played in this regard? And we'll start with Thelma.
You're muted, Thelma.
I keep doing that, sorry. They keep asking, and so I think that's the challenge, just because we come from a culture where our culture teaches that, from our familias, from our nanas, from our grandmas, from our tias, who ask, you have to give, and you have to give 100%, and so it's our culture to give, but so that's a challenge, the expectations that people assume that you're a Latina, you're gonna be there 24 hours a day, answering everything, working through everything, no matter what it is. And it's not, that's one of the expectations, right, of us as Latinas. And it plays a big role because, they assume that you wanna do this just because you're Latinas. One thing I wanna say, probably not related to this, but it's all related anyway, is that us, as Latinas, we have to remember that we come to the table with multiple things, not just a Latina, not just an indigenous woman, not just a doctor or a nurse. That we bring dual culture, dual language. Everything is double for us. So our value should be double than that. So that's my feedback.
I love that, and I agree with you. Otila, same question.
Sí, estoy de acuerdo con Thelma, como latinas venimos con muchos retos. Uno de ellos es el rol que nos ha impuesto la sociedad, en que como latina y como madre tienes que cumplir ciertos requisitos, y entonces no puedes trabajar acá o no puedes hacer allá porque tu familia, tú tienes que atenderla. El hombre trabaja, pero tu responsabilidad es tu familia, tus hijos. Entonces venimos cargando muchísimos roles que nos han impuesto, ¿no? Y entonces tenemos que ir contracorriente. Ese es uno de los retos que veo. Otro que he encontrado mucho a veces es la competencia entre nosotros mismos. Hemos escuchado que es importante tener un mentor y lo necesitamos definitivamente. Sin embargo, hay ocasiones en que en lugar de ser mentores, hay otras personas que te ponen más barreras, ¿no? Y viene una competencia, y en lugar de nosotros mismos ayudarnos a subir, a ser mejores, estamos poniéndoles piedritas a otras personas. Es algo cultural también. Algo que yo pienso que es bien importante, que nos inculcan también, al menos viniendo de México, es usted tiene que ser modesta, no esté presumiendo, no esté diciendo que usted puede hacer esto bien y que usted es así, o sea, y vienes y en la cultura anglosajona te dicen, ¿por qué te voy a dar este trabajo? Y tú estás acá tronándote los dedos porque no estás impuesto a resaltar lo que tú puedes hacer bien. Soy capaz de hacer esto, de esto otro, tengo este estudio. Bueno, entonces es algo que también tenemos que cambiar aquí en nuestra mente y decir, a ver, reconozco mis fortalezas y la capacidad que yo tengo. Claro, no para, como decía, presumir, sino para poder saber yo en dónde puedo ayudar y cómo hacer mejor un trabajo y competir por trabajos que anteriormente eran solamente para ciertas personas. Otro de las barreras cuando llega uno inicialmente a este país definitivamente es el lenguaje. Y antes de empezar esta webinar, les decía yo, para mí el español es muy rico, muy extenso y me permite expresarme muchísimo mejor que el inglés. Sé hablar inglés, sé leerlo, lo puedo escribir. Sin embargo, quiero tomar esta oportunidad para decirle a esas personas que están en el proceso de aprender un segundo idioma, que se puede aprender y se puede llegar a una posición de liderazgo, porque el trabajo, la calidad de trabajo que ustedes pueden hacer, la entrega, todo lo que hemos hablado, eso lo vas a transmitir. La otra parte, la habilidad de hablar un segundo idioma, eso lo puedes aprender. Así es que iba a decirles a los traductores que iba a hablar un poquito de inglés, nada más para que no haya confusión, nada más dos veces. Dice, I'm able to communicate in English, believe me, but I choose to speak Spanish because of course it's a very rich language. Pero me regreso nada más para que al español, porque yo sé que por favor, tampoco que no se nos olvide de dónde venimos, de nuestras raíces, porque en la comunidad allá afuera podemos encontrar muchísimas personas que solamente hablan el español y es una frustración, desesperación e impotencia no encontrar a alguien que pueda comunicarse contigo. Así es que gracias por la oportunidad y ya sabemos, traemos muchas barreras, pero también traemos muchas ganas, muchas fortalezas y entre nosotros nos podemos apoyar para seguir creciendo. Gracias por esta plataforma.
Gracias, Otilia. And that goes along with what Dana was saying, duality and the multiple strengths and talents that we bring to the table as Latinas. So thank you. Veronica.
What a question. I really love what my colleagues say. Telma and Otilia, I'm validating everything what you say, everything. And due to the fact that the cultural expectations may be so deeply ingrained, estamos encadenados a los cambios, to the challenges and beliefs and attitudes along with loss of past doubts. Maybe it is very necessary for women to let that go, that culture that is an obstacle sometimes that is holding us back to do what we want to do. The balance of family and work, Latinas feel as obligated so much with so many responsibilities and cultural expectations. As we as Latinas, we need to promote to all of us, that we have to be self-confident and allow us to feel more support, encourage, and motivate to do what we want to do, So it is very important that as a Latina, if you know somebody who is struggling to break these barriers, talk to them, be somebody that motivates somebody else to do better and change that. I mean, I don't want to say better, but change the barriers so we can become more like free to do what we want. Thank you.
Thank you, Veronica. And thank you to all our panelists. Our last question has really been answered throughout our conversation today, what individual, cultural, and family aspects have been facilitators in your development. So we spoke about families as role models, Maxine's Nana, Veronica's mom. Everyone's family has been in some way present in their development, as well as culture, community. So, and individual strengths that have been recognized by others, by yourselves, and in the process, some of you mentioned the importance of being able to kind of take power over that and let it be known that we do have these strengths, and that has been part of your development as leaders, as Latina leaders. So I truly appreciate it. We have some time for Q&A. Some of our participants have been asking for your contact information. So if our panelists want to share their contact information via the chat, you can do so that they have it available. That's part of what we do. We want to be able to connect, right? So if you're comfortable with that, please do so. If anyone wants to reach out to us, they can do so as well, and I'll share our email pretty soon. Any last recommendations you want to share before we move on to the Q&A?
I just wanted to say one thing that wasn't in the family, but that influenced a lot of why we're here today, and that is those external and political situations that have shaped our pathways. Like, and I know somebody wrote in chat, old school for me, but that's true, that's okay. I'm old school, but I have kids under 30, so they keep me on my toes. And I just want to say that those events were the civil rights movements, it's our human rights, it's the Chicano movement, it was the United Farm Workers, it's the women's movement, and that all of those converging have really helped pave the ways for our parents, for our grandparents, for us, for our children, and to keep that in mind, that we need to be on that pulse and continue to be on that pulse as well.
Thank you, Teresa. Let me see. Okay, so there we go. Someone here. So let's go to questions. Let's see if we have any questions now. Will you be sharing your contact information? So there was a question and now I'm not seeing it. If you can write it in the Q&A. Okay. Okay. I see that our panelists are not able to use the chat. Is that what you're saying? To share your information? Okay, so we can share it with, if everyone is okay with that, let me know and we'll be sharing it. Let me see if I can.
There was a comment or a question on like language access in like medical or certain fields. And then like Maxine said, I always get, like I do interpretation and translation work. And in the past, for the longest time, I did it for free because I'm the serving, right? Like I want to just help the community. But the last 3 years, I'm like, nope, I have to get paid for every work that. So now it's like they come and they're like, can you help me find someone else? And it's because they want someone else to do it for free. And so, yes, being that I know we don't want to be gatekeepers, but I want to be the gatekeeper to ensure those people get paid. So like, it's just a reverse on that, just making sure that someone else gets paid. Because even like literally yesterday, I put into the budget like $6,000, which is nothing, for interpretation translation service for my specific program. And I got questions like, but you can do it because you speak Spanish and you do interpretation. I'm like, oh no, I don't have the time for that. Like I'm putting it in the budget because I expect someone else to get paid. And they didn't like my answer. So again, I think, yes, being gatekeepers to ensure that no one takes advantage of somebody else, but also not being the gatekeeper and allowing others to come into the doors is important. But in terms of the language, like, it's a big thing. Like people take advantage of that constantly, especially Telma with promotores and CHWs, the people that are doing the work on the ground. Is just assume because they speak it and they're already out there, they're going to do it and I'll get paid for it. And so making sure that either what I say now is like, if you want them to translate in the field, then I expect you to pay for a training course for them to be able to do it properly. And then they can do it because then I'm building up their skills at least if they don't want to pay for them. But I think the language thing, because it's a culture thing, it's just they know it, they should do it, is a big one.
Thank you, Mirla, for clearing that up. Exactly. What gates are we helping stand guard to? And it's the ones that want access for free to our community, that I'm willing to stand at those gates all day long. And yeah, part of that around coaching institutions is exactly what Mirla just says that she practices, right? How many times have we seen grant applications or budgets where promotores, people with lived and living experiences, whether or not they're certified, translation, interpretation, are all either an afterthought or not budgeted for at all. Then later on, our community gets blamed for not showing up, not wanting to participate, or them not knowing where to find us. And so again, it's really putting the onus back on the folks who are getting funding for these services to say, well, that's because you need to weave in these practices from the very beginning, and you need to create a budget space for that, because we're either the last ones to get hired, we're hired under contract for very little money, and we're the first ones to get let go. And then they wonder why they have no access to the community. So very well said. Thank you.
Can I jump in?
Yes.
I want to say that I'm very proud that I'm with an agency that does pay for language competency. We pay 9% over base salary. We have over, I think, 40% or more of our staff are bilingual. We also have what we call threshold languages. It's not only Spanish, we have other languages that we utilize. We also have interpreter services contracted. And we have a cultural responsiveness plan. And in that plan is bilingual or language access. And I encourage everybody, if you want to even look at our plan as a prototype, I'd be happy to share it, but I encourage everybody to create a plan for the agency and then advocate for that. Even if you say, hey, I need 3 spots. We've gone full bore, and we have representation across the agency. It's not only clinicians, it's our support staff, it's our line staff, it's everybody in the agency where there's a position of need. So there are best practices out there. Let's share them.
Thank you, Teresa. We have another question. Do you have any book recommendations or authors that have helped you in your journey as Latina leaders?
Is that for Mirla?
Or anyone who wants to answer?
Unfortunately, I read nothing but fantasy, so I don't have a lot of.
I always plug this book. Promise I do not know the author, and I get no subsidy for this. But For Brown Girls with Sharp Edges and Tender Hearts was such a powerful book to read. The author, she also does a beautiful audiobook in English and Spanish. And this author wrote this as a love letter to other Latinas. She was one of those Latinas who immigrated to the US, experienced discrimination and stigma from from the Latino community when she immigrated to the US, was one of the, if not the only Latina students when she went to college. And so she writes this beautiful perspective of how we do have permission to understand our worth and to expect to be invested in at the level that we are worth. So I highly recommend that book.
Thank you, Maxine. I shared a few of the, Denmark, can you, okay, I can share with our audience soon the rest of the emails. I can do that. We'll be sharing that, and also, let me just move along here. Okay. So we are at the end of our panel. I would like to thank again our panelists for such a wonderful experience and conversation. We truly appreciate it, and we hope that our participants enjoyed it as well. We do want to share our future events just for those of us who want to join us. We'll have a session with SAMHSA next Thursday on 988 Suicide and Crisis Lifeline. And it's an opportunity for Latinx students ages 25 65 plus to join us and share give some feedback regarding the use of 988. What are their views on it? If they have any recommendations, we have limited spaces. So for those of you interested, you have the information over there. We'll also be having a webinar along with El Futuro at North Carolina. It's a webinar on recovery management for Latina communities. So our presenter will be Dr. Ana Hernandez. So if you're able to join us, we'll be happy to have you. I also want to share, very important, follow us on social media. And of course, our evaluation, you can access it over here with the QR code. So we appreciate you taking the time to please fill out our evaluation that will allow us to continue to do work such as this. So again, thank you everybody. Thank you for joining us. And we hope to see you again soon. Gracias. Take care.
Gracias. Thank you.
Gracias, gracias. Thank you.
Gracias.